to the Marathon Medic podcast. My name's Amy and I'm a junior doctor and running coach with an interest in sports and exercise medicine. These podcast episodes are usually pretty running focused, but in the next few episodes we'll be chatting about some other outdoor sports instead. On this episode, I'm joined by Dr. Megan Evans, a junior doctor and dive master working at the DDRC, the Diving Diseases Research Centre, which specialises in diving medicine and hyperbaric oxygen therapy. This episode is mainly aimed at healthcare professionals or those with a keen interest in diving, and we'll be discussing what makes a safe or unsafe dive, fitness to dive assessments, and what decompression illness is, as well as the symptoms to be aware of. As always, this podcast does not substitute for any formal training, but I hope our discussion will be of interest to those listening. Hi Megan, and thank you so much for joining me on today's podcast.
Thanks so much for having me, it's a pleasure.
So we're going to discuss dive medicine today, and there's obviously a particular reason why I invited you to speak about this, because you've got a very cool job at the moment. So would you mind explaining a little bit about yourself and what you're doing at the moment?
Yeah, of course. So I am currently working at DDRC Healthcare, which is a hyperbaric medical centre in Plymouth. I am working there for a year as one of their SHOs. I'm actually in my F5 year, if you want to call it that. And we treat divers, we treat other patients with hyperbaric oxygen therapy, we look at fitness to dive, we provide training, all sorts of different bits and pieces. So yeah, it's a really, really cool job.
And what attracted you to dive medicine? Because that's obviously not something we tend to cover in medical school, and it's definitely not something that we can rotate around during our foundation training. So what first, I guess it's quite obvious what attracted you to the role, because it sounds really interesting and really varied, but how did you find out about it?
So I am a diver myself. I've been diving since I was kind of a teenager, and I did my dive master training a few years ago. And while I was working as a dive master, I was really interested in the diving medicine parts of the dive master training, what to do with an unwell diver and things like that. And it just made me want to look more into dive medicine and the things that can happen. And from that, really, I just thought, well, why not combine my hobby and my career? And I found out about the DDRC job through the Adventure Medic page. Someone had written an article on it previously from kind of years and years back. So I just tentatively inquired to say, are you still offering this job for junior doctors? And here we are.
You mentioned a little bit about it before, but what kind of things do you do on a day-to-day basis?
Yeah, so the job's really varied. We hold the phone line, so the National Diving Accident Emergency Helpline, which is kind of through the British Hyperbaric Association. So we answer calls kind of 24/7, 365 days a year from divers all around the UK. We can either kind of give advice over the phone, we can advise them where their local chamber is, or if we think that they need to go to A&E, for example, instead. We see, obviously, any divers who are in our area or where we're their nearest chamber. We would see them and treat them if needed. And kind of the other side of hyperbarics is our elective patients. So we also use hyperbaric oxygen therapy to treat kind of a number of other conditions, including kind of non-healing wounds, kind of diabetic foot ulcers, osteoradionecrosis and other radiation tissue damage is a common one as well. And our fitness to dive clinics are another big part of the job, so advising divers on their fitness to dive with various different medical conditions. So yeah, really kind of lovely varied job and really interesting.
It sounds it, and we're going to dive into a few of those topics a little bit more in depth. But I was just wondering, from a diver perspective rather than a medic's perspective, what do you think the most important things are when it comes to planning someone's dives? Obviously, you see the worst case scenario, but ideally divers don't end up in your unit. So what are the things that divers can consider when they are planning their diving trips to try and minimise the risks to their health?
I think if you look at kind of incident reports and safety statistics for diving, it's actually a really, really safe sport. But where there are problems and where there have been issues and where people do end up getting hurt is largely down to diver error. By that, I mean things like kind of a diver feeling a bit ill but trying to push themselves and go on the dive anyway, when really they know that they should probably just sit this one out, or equipment failures because actually they've not had their regulator serviced in the last 6 years and they've just decided to go on a quick dive today, kind of last minute. So I think the planning side of things, in terms of making sure that you're fit to dive, your equipment is well serviced, and the conditions are appropriate, and you have the skills and the ability to be able to deal with the conditions that you're diving in, kind of really set you up for a safe dive initially.
And in terms of planning the dive itself, I've heard you speak a few times about dive profiles. So what is a dive profile and what constitutes a safer dive profile?
So a dive profile is essentially the course that your dive takes. And you can think of it as if you're plotting out the depth over kind of on the y-axis, over time on the x-axis. And if you actually draw it out, it will create a shape. And that's what we think of as the dive profile. The kind of classic dive profile, and the most simple and straightforward one, would be what we call a square profile. So that would be when you descend to your maximum depth, you spend the majority of your dive time at that maximum depth, and then you ascend to the surface. And that would create a lovely, nice square dive profile. Other common profiles would be a multi-level profile. So this might be where you descend to your maximum depth, you spend some time at that depth, then you ascend slightly, and you spend a little bit more time at the slightly shallower depth. And you can do that kind of in various different stages before your final ascent to the surface. So those are two examples of what I would consider to be safe dive profiles. The things that we try to avoid and the things that we would try to not recommend divers do would be reverse profiles. And by this, what I would mean is if someone spent time during their dive at quite a shallow depth first, and then went deeper, spent some time at depth, at their kind of maximum depth, and then ascended to the surface. And what you've got there is a reverse profile, because you're spending the shallow time in your dive at the beginning of the dive initially. The reason why we try to avoid this is because it increases the risk of decompression sickness. And the same if you're doing multiple dives in one day, we would always try to advise that you plan your day and plan your dive so that you're doing your deepest dive first, followed by your more shallow dives later on in the day. And again, that's the same concept. By doing your deeper dive first and then shallower dives, you're reducing the risk of decompression illness.
This might sound like a very silly question. Is that something that most people do? Because I suppose from my perspective, not having really any familiarity with diving, my gut instinct would be that it'd be better to kind of start shallow and gradually go down to deeper depth. But is it something that's well known within the diving community that that's how you'd have a safe dive profile, and you do start with your deeper dives first?
Yeah, I mean, it should be. And obviously, this all depends on who you're diving with. If you're diving with a dive organisation, hopefully that they would have thought about those things. If you're planning your own dives, then it's definitely something that you need to consider. And I think it should be, it should always be considered. If you're doing kind of very shallow, short dives, sometimes it wouldn't make much of a difference. For example, if I did a 20-minute dive to 10 meters, followed by a 20-minute dive to 15 meters, that technically would be a reverse profile. Although at those kind of shallow depths, it wouldn't cause too much of a problem. It's when you get onto deeper dives and longer dives, you really have a chance for that inert gas load, so that nitrogen load, to build up in your tissues. And then obviously that's what goes on to increase your risk of decompression illness.
And finally, just on the topic of planning dives and trying to make those as safe as possible, is kit and the gas mixers that are used important in terms of safety, or generally all of those things quite standard across the board?
So kit, I would say, is really, really important in terms of fit safety. So you always want to know that the kit that you're using, whether it's yours or whether you've hired it, is well maintained and serviced. You want to be familiar with all the kit that you're using. for example, if you've borrowed something and your release mechanism or your dump valves, for example, are in a different place that you're used to, in an emergency underwater, that could cause problems. So you really need to be familiar with the kit that you're using and comfortable and happy that you know how everything works and where all the bits are that you're going to need. In terms of gas mixes, most recreational divers and certainly more beginner divers will use compressed air. So there's no gas mixing, it's just normal air that gets compressed into the cylinders. As you get a little bit more advanced with your diving, Nitrox is becoming increasingly kind of used more frequently. Nitrox diving is diving using a gas that has a higher fraction of oxygen, a higher percentage of oxygen in the mix. So, for example, you might dive with Nitrox 32, which would have 32% oxygen in the cylinder as opposed to your normal 21% oxygen in air. The more advanced you get and the more technical diving you do, you can go on and use other gas mixes, including helium. So you can have heliox mixes, so helium and oxygen. You can have tri mixes, so helium, oxygen, and nitrogen. And essentially, diving is as simple or as complicated as you want to make it. And there are lots of amazing, very experienced tech divers who do very complicated diving where they have different cylinders with different gas mixes in them for different stages of their dives. And by the time you get to that level, you should absolutely know what gas mix you need when and why, and be comfortable and safe with the equipment and who's mixing your gases and all of those things. But as I say, for most divers, and certainly beginner divers, you're just looking at compressed air in your cylinder. And the main thing that you need to check is your cylinder full, and does the air taste clean when you try it, to make sure it's not contaminated.
This is all making running sound very simple and straightforward.
less kit with running, I guess.
Absolutely. From the medical perspective, you mentioned that you do fitness to dive assessments. So what kind of things are you looking for when you're doing those assessments? And are there any particular contraindications to diving that would kind of raise alarm bells in your mind when you're assessing somebody?
Yeah, so fitness to dive is really important, and I think it's something that often in the dive community itself can be overlooked. As someone who has fitness to dive conversations with people, I always want to try to enable people to dive safely. I don't want to stop people from diving or say that they can't dive or they're not safe to dive. But really, as I say, it's about enabling people to dive safely. There are things that would be contraindicated to be a safe diver. And really, when we're looking at fitness to dive, you can kind of do it in a systems approach. Respiratory is obviously a big one when you're thinking about gases and pressure of diving. And with respiratory, the main thing that we look at is conditions which will increase the risk of gas trapping. So any bronchoconstriction, so asthmatics, COPD, or any kind of cavitating lesions, kind of air spaces in the lungs, where gas might be caught and be not exhaled fully, will increase the risk of having pulmonary barrier trauma. So essentially developing a pneumothorax because of a burst lung because of that change in pressure. Kind of moving on to cardiovascular, you need a well-functioning cardiovascular system. There is a condition called immersion pulmonary edema, which doesn't just apply to divers, it can affect swimmers and triathletes and anyone in the water. But it's a condition where the hydrostatic pressure of the water around you essentially forces blood to pool centrally. Vasoconstriction caused by being in cold water will exacerbate this, and you can overload the cardiovascular system and end up with acute pulmonary edema, which can be life-threatening. So people who have hypertension are at increased risk of this, and certainly people who have kind of other more complex cardiovascular issues will definitely need a cardiovascular assessment to ensure that they're kind of not putting themselves at undue risk. So by looking at different systems and by considering the underwater environment, whether that's the pressure or whether that's the gas kind of mixes itself, you can have a look and see what you need to think about with each individual's medical history.
On a more day-to-day basis, for divers that aren't necessarily being assessed for fitness to dive, but they might be on a diving holiday or trip or just with their friends, what kind of things should they be thinking about that should make them stop going in the water? So you mentioned earlier, often these accidents that happen or injuries, or when people become unwell, it's often because of human error, maybe people going diving when they shouldn't be. Is there any particular things that would make you worry, or is it just anything that might make someone feel unwell or under the weather that they should just not dive that day?
So I think in general, if you're feeling under the weather, you probably shouldn't dive. And just from a kind of general fatigue point of view, when you're diving, yes, the vast majority of the time you're going to be completely fine and you're going to have a lovely dive. But there's always that risk of, for example, being caught in a strong current, needing to rescue a buddy. You kind of need to be mentally sharp, have that clarity, and also physically kind of strong and fit enough to deal with those emergency situations. In terms of specific things, one of the most common ones would be congestion. So if people develop a bit of a cold, bit of a upper respiratory tract infection, and they have congestion, it's going to impact their ability to equalize their ears when they're underwater. So when you're diving, you need to equalize your middle ear space. People can do this by doing kind of a gentle Valsalva underwater, or kind of yawning, wiggling their jaws, all sorts of different techniques. If people are congested, then that will impact their ability to equalize, and they could end up with middle ear barotrauma. I guess the other thing would be if you have had, particularly for people who are on diving expeditions or on holiday and they're doing lots of diving or lots of swimming, if you are having kind of ear pain, or if you have had some ear pain on a dive, I would advise not to dive again until it's settled down or until it's been looked at, because people kind of try to push it and push it and push it, and then end up with a horrible otitis externa, horrible ear infection, or alternatively a perforated eardrum. Those are, I think, the really common ones for recreational divers.
Thank you. That's really useful to know, and I think you can be under quite a lot of pressure probably in those situations to dive if you've only got a certain amount of days that you're on holiday and able to do that. You can kind of push yourself to do things that maybe in a different setting you wouldn't be forcing yourself to do. So that's really helpful. Thank you. Yeah. Moving on to the, I guess, more negative side of diving, so the medical problems that are associated with diving. Obviously, hopefully quite rare and doesn't happen to the majority of people that are diving. We've touched on decompression illness, which I guess is more commonly known as the bends. Would you mind just explaining exactly what that is, and also what kind of symptoms divers, medics, and people that are with divers should be on the lookout for?
Yeah, absolutely. So decompression illness is, as you say, a condition that affects divers and kind of people working under pressure. It's actually an umbrella term which encompasses two separate pathophysiologies, if you will. So decompression illness covers both decompression sickness and arterial gas embolism. They are both conditions caused by gas bubbles being in the wrong places, in its simplest terms. So decompression sickness we can think of as evolved gas. When you are diving, you are inhaling the gas from your cylinder at ambient pressure. So if you are 10 meters underwater, the ambient pressure is around 2 bar or 2 atmospheres. That means that you are inhaling your oxygen and your nitrogen in your gas cylinder at ambient pressure of around 2 atmospheres. As you do that and throughout your dive, because you are taking on board more nitrogen than you would normally at the surface, that nitrogen can accumulate in your blood and in your tissues, which is absolutely fine. The issue is when you then decrease in pressure, i.e. when you ascend from your dive, that nitrogen will then start to come out of your tissues and come out of your blood. And the idea is, what we want to happen is that will make its way to your lungs and be exhaled normally, and you don't have any problems and you're well. What can happen if you have made, for example, a very rapid ascent, is that nitrogen doesn't have a chance to diffuse out through your tissues, into your blood, through your lungs and be exhaled. And instead it comes out of solution and forms bubbles of nitrogen in your blood and in your tissues. And those bubbles can cause symptoms depending on whereabouts they are in the body, where they form in the body. So that's how decompression sickness works. Arterial gas embolism we think of as escaped gas, and the most kind of well-known form of arterial gas embolism is if you have a pulmonary barotrauma, so you have a pneumothorax under the water, an alveolus pops because of the pressure changes, and you have air which can pass into the circulation because of that damage, and then you have essentially a gas bubble in your arterial circulation. And the most kind of serious form of this would be a cerebral arterial gas embolism, which obviously would cause stroke-like symptoms.
So I actually didn't appreciate that was an umbrella term, and there were two different kind of aspects of that. So thanks for clarifying that. And as you mentioned, the symptoms that you will get will depend what body system is affected, and many body systems can be affected by this depending on where the gas bubble ends up. What are the most common things that you would see, say if you're a medic on a dive expedition? What symptoms do people commonly present with?
So, as you say, quite rightly, it can affect any system of the body. Hopefully these things aren't common at all, but things that you would want to look out for would be musculoskeletal, so joint or limb pain. The bubbles can form kind of in joint spaces themselves, commonly affected kind of shoulder, elbow and knee joints, but can be any joints. Skin, so cutaneous bends, where people have bubbles forming in the layers of their skin. They can have a mottled rash, which is called a cutis marmorata rash. It's kind of a red mottled appearance. It can be a bit itchy. People can get lymphatic bends, which is very rare, but where you can have bubbles in your lymphatic system or in the veins draining your lymphatics, and people can present with swelling, so kind of unilateral one-sided arm swelling or breast swelling, for example. Some of the more kind of serious, I guess, and the more worrying forms of DCI, the neurological DCI. So depending on where the bubbles are in the brain or the spinal cord, you can have a whole host of different neurological symptoms, whether that's weakness, sensation changes, cranial nerve deficits, so eye movement, speech difficulties, facial drooping, all of the things that you might expect in someone who might have a stroke. Equally, you can have audiovestibular decompression illness. So this is when you can have gas bubbles in the inner ear itself. And this would present with a lot of nausea, vertigo, kind of an ataxic walk. So people really kind of staggering about, feeling very, very sick and dizzy. That would be an audiovestibular bend. And these things can occur independently, or you might have people with a variety of these different symptoms. Just last week, I saw someone who had both shoulder pain and neurological symptoms. So you can have combinations.
So I suppose, in a way, anything that's abnormal for that individual or any symptom they have should be considered as, potentially being as a result of their diving. If they have just come from diving, it's likely that those symptoms are attributable to that.
Yeah, absolutely. And I think, divers hopefully recognise the fact that any symptom that occurs after diving, it's best to discuss it with a diving doctor to kind of get that assessment and get that review. And equally with medics, you need to think really anything that occurs within kind of 24, 48 hours of someone having been diving, up to kind of 72 hours, although most present much sooner, need to be considered. Could this be a diving related illness or injury? And you always need to have that in the back of your mind when seeing anyone who's been diving.
And am I correct in thinking that these symptoms will probably evolve over time? So it might start with something relatively benign that maybe a diver could ignore, but then that symptom might develop?
Yeah, so, symptom courses can vary. Definitely some can develop, which is why it's important to kind of have that conversation as soon as you notice that symptom. Some may not develop, some may just stay the same. So particularly the kind of joint pains, the skin bends, some even resolve by themselves. Even if you have a very kind of mild or minor symptom like a rash, or just a very mild pain in your shoulder, for example, that you're not too worried about, or that is actually going away by itself, I would say it's still better. You still need to speak to a diving doctor, and certainly not go diving again until you've spoken to a diving doctor, because it actually might be, there might be other subtle symptoms that you've not actually noticed yourself, which might be picked up on a full neurological assessment. And B, there might be an underlying reason as to why you've had this problem, particularly with divers who have symptoms of decompression illness after having completed a normal dive with, that lovely dive profile that we spoke about. They didn't have a rapid ascent, their dive was absolutely lovely, and they've still got a decompression illness. We need to really ask ourselves why. And in these individuals, we would think about screening for a PFO, so a patent foramen ovale, a hole in the heart, which can increase the risk of decompression illness. So yes, these symptoms can evolve, and yes, you definitely need to be reviewed, particularly if they are getting worse. But even if they're not getting worse, even if it's something mild that you're not concerned about, there actually might be something else going on that we need to look into, that we need to pick up.
That's so interesting. I'd never heard of the link between PFO and decompression illness. So that's definitely my take-home message from this. And then I guess this kind of all links back to your role at the DDRC, in that hyperbaric medicine is used to treat these diving conditions. So I assume when you're in these dive settings, the priority is to obviously firstly speak to a diving doctor, but if this is considered a decompression illness, to get somebody to a hyperbaric chamber.
Yeah, absolutely. So I think if you are particularly a medic, but really anyone around a diver who has developed any symptoms after diving or feels unwell, absolutely, as you say, you need to get on the phone to a diving doctor. In the UK, we've got the National Diving Accident Helpline. When you're abroad, there's various kind of diving organisations. DAN is the big one, kind of divers insurance company. And the other thing that you can do for your patient or for the diver is put them on oxygen at surface. So most dive shops, in fact, all dive shops should have 100% oxygen cylinders that a diver can breathe from if they feel unwell after diving. And that's really your initial first aid, regardless of what their saturations are, regardless if they don't feel short of breath, they're not having difficulty breathing, they've got symptoms after diving that you think might be due to decompression illness, you put them on oxygen. And essentially this will help, then if they're breathing 100% oxygen, they're not taking any more nitrogen on board. So you're not going to hopefully make those bubbles of nitrogen grow any bigger. But also you're going to help eliminate nitrogen from the body quicker by kind of increasing that diffusion gradient by just breathing pure oxygen.
And without going into too much of the in-depth medicine behind hyperbaric medicine, because obviously it's quite a complex topic, would you mind just briefly touching on what hyperbaric medicine is and why that is the treatment for these diving-related illnesses? Yeah,
so kind of diving and hyperbaric medicine is the treatment using hyperbaric oxygen. So by that I mean high pressure oxygen. So hyperbaric just means high pressure. So what we have hyperbaric chambers, which are solid airtight structures that you put the patient into, pressurize the environment. So you pump lots of air in to make it a pressurized environment. And you have the diver or the patient breathing oxygen in that pressurized environment. They are breathing a hyperbaric dose of oxygen. With diving illnesses, this helps kind of in two ways. The pressure itself, being in a pressurized environment, will help squash and crush any of those bubbles that are causing problems. So obviously, as the pressure increases, the volume decreases of gases. So that's Boyle's law, if we've got any physics enthusiasts out there. So you increase the pressure and that will squish those gas bubbles that are causing the problems and help get them out, help you be able to eliminate them. And the other thing is the very high pressure of oxygen, as I say, will help eliminate the nitrogen that's built up in the tissues faster. And hyperbaric oxygen also has anti-inflammatory kind of effects and will help deal with the consequences of having that bubble. Imagine if you have a bubble that's stuck in a blood vessel, your body acts as though this is a foreign object, and you have a big inflammatory cascade, and you get swelling, and you get all of your kind of cytokines and your leukocytes and everything involved. And it's actually that inflammation that causes the symptoms as much as the bubble itself. So hyperbaric oxygen helps deal with that as well. So it's kind of a two-pronged treatment approach. You've got the pressure and you've got the oxygen.
Great, thank you. That's really interesting, especially because it's not something that we use day to day. So it's nice to hear from you, who's obviously working in that setting, a little bit more about how that works. Finally, do you have any kind of final tips for people that are either participating in diving or any healthcare professionals that might be, when things open up, going on trips and working as diving medics?
So I think if you're a medic and you're going to be working in situations where you might be asked to look after divers, I think it's really, really vital that you make sure that you have some diving medicine training before you go out. I know a lot of kind of medics go off on expeditions and are looking after divers, but I think doing a course in kind of diving expedition medicine or doing a bit of research into dive medicine is really vital, because you need to know what you're looking for and what to do if something does go wrong. For divers themselves, it's been a lockdown for everyone, and there are a lot of divers now who are just starting to get back in the water kind of post-COVID. And I think, what we're advising everyone is make sure that your health and your fitness level is okay before you go back to diving. So don't expect, if you've been kind of a bit more sedentary over the past year than you were before, to go straight back to doing kind of deep and complex dives. Ease yourself in slowly, refamiliarize yourself with your skills, make sure that you've had your kit checked, because it's probably been sat in the boot of the car or the shed or the garage for the last year, and just make sure that you're doing things at a slow rate and you're not trying to jump back in. Equally, kind of on the COVID kind of thoughts, we are seeing divers who are wanting to get back into the water after having had a COVID infection. And the current advice is, because of the risk of lung damage, you do really need to be seen by a diving doctor before getting back into the water as well. So those are the things that I would say to divers at the moment.
Yeah, that's a really, really good point about the return to diving. And I think it's relevant to returning to sport in general, that we're obviously all kind of eager to return to what we used to do, and have to appreciate that it's going to take some time for our body to adapt. If people do want to find out more about you or more about the DDRC, do you have any recommendations for them about sites they can visit, and also any resources for people either partaking in diving or healthcare professionals that want to learn a bit more about dive medicine?
So the DDRC website, so that's ddrc.org, has some really good information, particularly aimed at divers on different conditions. So can I dive with X? Can I dive with Y? The UK DMC website, so that's the UK Diving Medical Committee, also has a lot of really good information and information as well, kind of more aimed at medical professionals, I guess, on various different medical conditions. And how that impacts people's fitness to dive. So that would be definitely one that I would check out if you're interested. There's also a book which is called, if I can remember, FAQ in Dive Medicine by Oliver Firth, which is a really good resource, which is kind of aimed at both divers and medics, and again answers lots of questions about dive medicine and about fitness to dive queries. So I'd recommend that one.
Great, thank you so much. This has been a really interesting conversation, especially for me, who knows nothing about dive medicine. So thank you so much for your time.
No, thank you. It's been great, and hopefully I've not put too many people off diving. There are some scary things that happen, but they're very rare, and I want to get everyone inspired to get in the water if they can. So.
Many thanks to Megan for joining me today to discuss dive medicine. If you want to hear more from Megan, then you can find her on Instagram by searching Dr. Megan Evans, and you can find out more about the Diving Diseases Research Centre at ddrc.org. If running content is more your thing, then be sure to head to marathonmedic.com, and I'll be back chatting about running again soon. Thanks for listening.